Welcome back to video 11 of the EKG Detective. For this episode, we will be looking at idioventricular rhythms. The EKG Detective is dedicated to helping people make the transition from using inductive logic to deductive logic. And if you'd like to learn a little bit more about the difference between the two, you can go back to video 1, where I spend some time talking about the differences between the two. Throughout this entire series, we are going to use two job aids. The first job aid is the EKG Detective Interpretation Checklist. The nice thing about this checklist is it really helps illustrate the mechanics of how deduction works. And if you're interested, just reach out to me at relevanceineducation.com and let me know that you would like a copy of the checklist, and I will make sure that I email one out to you so that you can use that as we go throughout this series. The second job aid that we are going to be using is the EKG Detective phone app. The app, unfortunately, is no longer available for Androids at the Google Play Store due to technical support issues, but it is still available at the Apple Store, and you can just keyword search EKG Detective, and that will take you to the page to be able to download a copy of the app. But you definitely don't need to have the app to be able to work through the process of deduction. So the biggest question to ask is who can benefit from using EKG Detective? And the answer to that is anybody who is struggling with an ECG interpretation. The nice thing about this process is it allows you to focus on the waveforms and the things that you can see in the ECG, and you don't have to spend as much time focusing on the criteria within an ECG. All normal rhythms originate from the sinoatrial node or the SA node. Ventricular rhythms originate within the ventricles, and those locations can be anywhere within a bundle branch or within the Purkinje network, but it will be outside of the SA node, and it's considered to be an ectopic rhythm. So here are two examples of typical idioventricular rhythms. If you notice the regularity, they seem to be very regular, and that is generally the case when we're dealing with a rhythm that originates from one focus, as they do tend to be regular. So when we open up the EKG Detective app and look at the first question, which is the rhythm regular or irregular, if we notice the rhythms are regular, and that's going to be the case with idioventricular rhythms. So with that, we will go to the app, we will select regular, and then we'll hit next to go to the next screen. For those of us who are using the EKG Detective checklist, since the rhythm is regular, we'll be able to get rid of any rhythms that are irregular. And we can also get rid of ectopic beats, because ectopic beats actually are beats that create irregularity, and since we have a regular rhythm, we can get rid of all of those rhythms from the checklist. The next question that the app is going to ask is what the ventricular rate is. And there are basically two types of idioventricular rhythms. There's going to be idioventricular rhythms that are 40 beats per minute or less, or we will have idioventricular rhythms that are between 41 to 99 beats per minute. And our two examples gives us an example where we have idioventricular rhythm at 40 beats, and then the one below, it's beating about 80 beats per minute. So we will select any rate somewhere between 40 to 99 beats per minute, depending on the type of idioventricular rhythm that we are looking for, or that we're ultimately looking at. So those of you who are using the app, since the rate is less than 100 beats per minute, we can go to the regular side and eliminate any rhythm that is tachycardic at 100 beats or more. And that's what our checklist will look like after we've eliminated those tachycardic rhythms. The third question that the app is going to ask us is if there are P waves. And idioventricular rhythms will not have P waves because they don't originate within the atria. They originate within the ventricles, and P waves are created when an atrial focus, either the SA node or an atrial focus, depolarizes the atria, and that impulse works through the AV junction. And since these rhythms don't originate there, we're going to have no P waves. So when we look at this rhythm, we are going to go to no P waves on the app, and then we will select next to go to the next screen. Referring to our checklist, since there are no P waves, we'll be able to eliminate all of the rhythms that are associated with P waves and end up with these two options based off of this question. The next question that the app is going to ask us is what the width of the QRS complex is. And since we're dealing with a ventricular rhythm and we're outside of the normal bundle branch system as well as the Purkinje system, impulses are going to travel significantly slower than if those impulses came down through the AV junction and actually worked their way through the bundle branches and Purkinjes. And what ultimately happens with the ventricular rhythm is the ventricles depolarize significantly slower than if we're going through the ventricles. So as a result, when we go to measure the QRS width with the ventricular rhythm, they're going to measure wide and bizarre. And wide is considered to be 0.12 seconds or greater, and the bizarre appearance occurs as a byproduct of depolarizing via myocardial muscle tissue and not going through the bundle branch system. So with this, since we have wide and bizarre QRS complexes, or wide QRS complexes, we will go to the app, we will select 0.12 seconds or greater, and then hit next to go to the next screen. And with that, the app's going to take us to the rhythm being an idioventricular rhythm. If we would have chose, in this case like we did, the ventricular rhythm was 40, we would have an idioventricular rhythm. If we would have chose 41 to 99, it would have been an accelerated idioventricular rhythm. But since we're dealing with the rate of 40, we're looking at an idioventricular rhythm for this specific example here. So referring one last time to the checklist, since the QRS complexes are 0.12 seconds or greater, that means we can eliminate junctional rhythm as well as accelerated junctional rhythm, because junctional rhythms are typically associated with narrow, normal-looking QRS complexes. And that leaves us with the idioventricular rhythms that we were dealing with, either accelerated idioventricular or idioventricular based off of those rates. All right, that brings us to the end of this episode. I just want to reiterate, if you would like to get a copy of the EKG Detective checklist, just reach out to me and I'll make sure that you get a copy of it. Also, if you have any questions about the EKG Detective phone app, you can reach out to me at relevanceineducation.com, and I would be more than happy to try to answer any questions or get you the resources that you need. And if you haven't done so, I would really appreciate if you would subscribe and like this video, because it definitely would help out as I'm trying to get this channel up and running. And I appreciate you for sitting through this video, and just remember that it is always better to practice as a clinician rather than a technician. See you next month.